Good morning, I'm Dr. Louis Siegel. I'm a dermatologist here in Bell Harbor, New York. I practice here Monday through Friday and I offer comprehensive dermatological services to patients of all ages, including medical, surgical, and cosmetic dermatology. So, this morning I'm going to take a few questions, okay? Our first question is, at what age should you begin seeing a dermatologist for yearly skin checks? That's a great question. There is no set standard for this. Various colleges and organizations have kind of been wrestling with this question for a while. The short answer is there is no set standard, but in general I recommend usually early adulthood, starting anywhere from 18 to 25, and you should consider getting earlier skin checks if you have a family history of melanoma. So in families that have a history of melanoma, children, once they start having moles, it's a good idea to have them checked out on a yearly basis. Okay. Next question, is it bad to get a lot of freckles during the summer? Yes, that is the short answer. Unfortunately, it is a marker of sun damage, and patients who do freckle actually do have a higher risk of having melanoma. So in general, avoidance, SPF 50, and it's very important to reapply every 4 hours and really reapply every hour or two if you're sweating or going in the water and out of the water, etc. Okay, our next question is, what conditions can be helped with laser treatments? A lot. So they make so many lasers nowadays. Lasers can treat sun-damaged skin. Okay, those are called ablative lasers, like a CO2 laser. Lasers can treat veins. They can treat acne. They can treat rosacea. They can treat dark spots. They can even treat warts. So they really, make lasers for almost anything nowadays. And there are actually even lasers out that can reduce fat. So if you're curious in particular, if you're concerned about a condition, you could always look it up online, and even for the one condition, there are multiple lasers sometimes for that one condition. Okay, our next question, is skin cancer genetic? Skin cancer, all forms of it, does have a genetic component. That being said, basal cell and squamous cell are more so due to sun damage, but they still do have that genetic component. However, melanoma, which is the third most common skin cancer and the deadliest form, does have a big genetic component. So out of those three, melanoma is the most related to heredity. Okay, how is skin cancer treated? There are various methods to treat skin cancer. There are so many different subtypes, and depending on the type that you have, the treatment can be anywhere from simply putting on a topical cream to having it excised via Mohs surgery or just traditional excision. And in between that, there are skin cancers that can simply be scraped and burned within the office, and that's usually a procedure that takes about 15 minutes. But again, there are multiple ways to treat skin cancers. Okay, and what are some of the signs of skin cancer? So, skin cancers can come in many different forms. Again, the first, most common type is basal cell, then after that it's squamous cell, and then the third is melanoma. So I'll give you a description of what we look for in melanoma, because that is the one that we are always screening for. It is the deadliest form of skin cancer. So we go by the A, B, C, D, E's of melanoma. So A, we look for any spot, any dark spot that's asymmetric, okay? B is for borders, so if one side of the circle of the mole is like jetting out, or there's just any irregularity along that border. C is for color, so when we start seeing multiple colors in a mole, that's when we start to be concerned. D is for diameter, so diameter, typically the cutoff, people will say 6 millimeters, so anything larger than that is a little bit concerning. And then E is for evolution. Evolution means changing over time. So a mole that started out, looking one way, all of a sudden got darker, it got larger, the border is now irregular. So those are changes that would be very concerning. Okay, next question, how does a chemical peel work? That's a great question. So basically a chemical peel works by disrupting the bonds between the skin cells. So our epidermis, which is the most outer layer of our skin, is made up of many, many small cells that are connected via bonds, okay? And a chemical peel, when applied, it disrupts those bonds. So if these represent cells, once the bonds start being disrupted, the cells start getting shed off, and that's called exfoliation, okay? And once those cells are exfoliated, quite often those are damaged cells, and under it are healthy cells that come in and start to replicate and rejuvenate the skin. So that's why chemical peels can help with pigmentation, sometimes superficial wrinkles, and other skin disorders. What is the best way to prevent wrinkles? So the best way to prevent wrinkles, and the easiest thing to do every morning, every patient should be using some form of moisturizer that has a sunscreen. We used to recommend only SPF 30. However, SPF 30, when applied, is more like SPF 15. So the old standard, people would always say SPF 30, but those were perfect lab standards where they were globbing on sunscreen. No one really applies sunscreen like that. So when your average person is putting on SPF 50, that's actually more like SPF 30. So therefore I recommend SPF 50 to all my patients, and typically in a form of a moisturizer. So your skin won't be getting too dried out, and it's just a great habit to get in the morning, and that's one of the best things you can do for prevention. And then at night, retinoids are very good for preventing wrinkles. Okay, they also increase collagen production in the dermis. So I usually recommend those two things. So again, a moisturizer with sunscreen in the morning. That sunscreen should have an SPF of 50, and the retinoid at night. And typically retinoids are available in different forms. The one that's most widely used over the counter is retinols. Okay, next question. How does Botox work, and do I perform Botox in the office? So yes, I do perform Botox in the office, and the way it works on dynamic wrinkles. And when I say dynamic wrinkles, when I go like this, I'm creating wrinkles as the underlying muscles move in, okay? Static wrinkles are wrinkles like across here that you can still see when my face is at rest, okay? So again, Botox works on dynamic wrinkles by weakening the muscle slightly that's essentially pulling on your skin. So let's take this muscle for example. This is your frontalis muscle, and it extends upward like this. So when I raise this muscle, it creates wrinkles up here. By injecting Botox in here and weakening those muscles a little bit, the dynamic wrinkles will not be as visible. Okay? And yes, I do Botox in the office, and I believe my prices are listed on the website if you're interested. Next question we have, there are so many face scrubs out there, it's hard to know what's actually the best. What are your recommendations for choosing the right one? So, in general, I know they're called face scrubs, but I don't like the term scrub because I see patients that come in after using a face scrub and they were literally scrubbing their skin with it that they get so irritated. So rule number one with any of these, do not scrub your face, okay? Gently massage the wash into your face and then rinse off with water after getting a good lather. So there isn't one scrub that fits all skin types, okay? Let's say if you have oily, acne-prone skin, then I typically recommend a wash or a scrub that has salicylic acid. That's a great product that'll help unclog your pores, and it also gently exfoliates. But again, please do not scrub because you will get very irritated. Simply just massage gently the wash into your face, and after getting a good lather, rinse off with water. Okay. Next question we have, what is the best treatment for sun-damaged skin? Really the gold standard still for sun-damaged skin that has a lot of pigmentation, wrinkles, or even some redness to it is probably still CO2 laser. I do not have that in the office. That is an intense laser procedure, but that is the gold standard right now. There are other lasers that aren't as harsh, but they will not give you the same result, and quite often they do require more treatments. Okay, next question. Do over-the-counter anti-wrinkle creams actually work? So that is a great question. The short answer is they do, modestly. Again, retinoids or retinol over the counter is typically the best. That will increase collagen production in your dermis and thereby filling in some wrinkles and also preventing some wrinkles as well. So that's usually what I'm recommending. Other products out there like Olay Regenerist are actually pretty good as well. Basically, you want to look for a product with retinoids, peptides, and now there's other products out there with growth factors as well, but those sometimes are a little bit difficult to come by. Okay, and our next question is, do blackhead/pore cleaning strips work? Yes, they can work. However, when you're putting the strip on your nose or wherever else, the majority of what you see on that strip is actually just normal material that's simply in your pores, and patients quite often freak out when they see it. They're like, oh my goodness, look at all these blackheads. But the answer is most of those are actually not blackheads. They're just simply a normal sebaceous material that is found in the pores. Okay, next question. What are the best ingredients to look for in over-the-counter acne treatments? So the best ingredients that have the most proven efficacy, again, salicylic acid is very good, and also benzoyl peroxide. Okay, but again, with any of these washes, just be careful not to irritate your skin. Do not scrub too hard. Gently massage in, get a good lather, and then rinse off. Our next question is, can psoriasis be treated with light therapy, and is psoriasis genetic? So yes, psoriasis can be treated with light therapy. I do have a light box in the office, and I also do have a smaller handheld light device as well for patients that don't have a large body surface area. And psoriasis does have a big genetic component. We find that, even if a patient's immediate family did not have it, they might have had a distant cousin or an uncle that had psoriasis. And also keep in mind, having dandruff goes along with psoriasis as well too. So even if you can't identify someone in your family that had psoriasis, there's a good chance that someone in your family does have dandruff. And there can actually be a spectrum with dandruff called sebopsoriasis. Dandruff is the term for seborrhea, and sebopsoriasis is when it starts getting so scaly and thick on the scalp that there actually becomes a little bit of an overlap. Okay, and our last question is, if you have skin cancer once, are you likely to develop it again? Yes. If you have a diagnosis of skin cancer, you are more at risk for getting another diagnosis of skin cancer. So that's why regular body exams at that point are very important. And depending on the type of skin cancer you had, that usually determines the interval of how often you should be getting a body exam. All right. Thanks for tuning in. I hope that was helpful. And any questions, please type in more. I think we'll be here for a few more minutes. And I'm always here at the office Monday through Friday. My telephone number is 718-318-3434. And you can always ask me questions over the phone or schedule an appointment for a consultation. Thank you.